All right, buckle up because today we are diving into something that, well, you might want to make sure you're sitting down for this.
Okay, I'm intrigued.
This is one of those things that when I first heard it, I thought, okay, this has to be like some kind of mistake.
Yeah, I get that.
We're talking type 2 diabetes and alcohol. More specifically, the potential upsides of, get this, moderate alcohol consumption. Yeah, I know, it sounds a little crazy.
It's definitely one of those things that raises eyebrows, right? I mean, we're so used to hearing about the negative health impacts of alcohol.
Exactly. And we are absolutely not giving out medical advice here, folks. Always talk to your doctor. But the research on this is honestly pretty mind-blowing.
It really is. For people managing type 2 diabetes, the emerging research suggests there might be some benefits to moderate alcohol intake.
So let's unpack this for everyone listening. One of the biggest things we see popping up again and again is this idea of improved insulin sensitivity, especially when it comes to red wine. Can you break it down for us? What makes insulin sensitivity so crucial for someone with type 2 diabetes, and how on earth does alcohol even enter the picture?
You bet. Insulin sensitivity is basically how well your body responds to insulin, which you know is the hormone that regulates your blood sugar levels. And as you know, with type 2 diabetes, the body doesn't always use insulin effectively, and that's what leads to those high blood sugar levels, right?
Exactly.
What's fascinating is that some studies suggest moderate alcohol, and we're really emphasizing moderate here,
Right, of course.
that this moderate alcohol intake could actually make your body more sensitive to insulin. So in theory, for some people, it's possible that moderate alcohol could mean better blood sugar control and maybe even reducing their medication needs.
Whoa, that's massive if it's true. But I gotta stop you there for a sec. We're not saying everyone should start pouring themselves a glass of wine with dinner, are we?
Definitely not a green light. Remember, it's all about moderate consumption, and there's a whole bunch of other factors that come into play too.
Mm,
Like, we can't forget about heart health, which is a big one.
absolutely. That's always top of mind for people with type 2 diabetes. They face a much higher risk of heart disease, don't they?
They really do. And that's where we have to talk about HDL, the good cholesterol.
Right. The good cholesterol.
Moderate drinking, some studies suggest, could actually bump up those HDL levels.
Okay, I think it would be super helpful if you could explain exactly what HDL does and why it's so important for heart health, especially when we're thinking about this in the context of someone managing type 2 diabetes.
Absolutely. Think of HDL like a tiny little garbage collector zipping around your bloodstream, scooping up all the harmful cholesterol that's clogging up your arteries.
That's one way to put it. Love it.
Keeps things running smoothly. And for someone with type 2 diabetes, this is even more crucial. Diabetes, unfortunately, can really speed up that plaque buildup in the arteries, making heart problems even more likely. So anything that potentially gives HDL a boost could be a real game changer for lowering that risk.
Okay, so we've got this possible good news for insulin and heart health, but then there's this whole other side, the potential downside, what I call the blood sugar roller coaster. What's the deal with that?
That's an important point. Can't forget that part. While some research says moderate alcohol might cause a temporary dip in blood sugar, this effect, well, it's unpredictable, to say the least. It varies hugely from one person to the next.
And that's where the real risk comes in, because that unpredictability could actually be really dangerous for someone who's trying to carefully manage their blood sugar levels.
Exactly. Those sudden, unexpected drops in blood sugar, what we call hypoglycemia, those can be seriously bad news, especially for folks with diabetes. We're talking dizziness, confusion, even fainting. That's the last thing we want.
So, where does this leave us? It feels like trying to navigate this potential benefit comes with some serious caveats.
No doubt about it. And that's why it's absolutely essential, and I really can't stress this enough, to talk with your healthcare provider before you even think about incorporating alcohol, even in moderation, into how you manage your diabetes.
Right.
They're the ones who know your medical history, the medications you're on, and can really figure out if even a little bit of alcohol is a good idea for you personally. This is not something you want to experiment with on your own.
It's not a DIY kind of thing.
Not at all.
Especially because, let's be real, we're talking about potential benefits, but there's always a flip side. We got to remember those risks. Putting on extra weight, potential liver problems, and even some medications just don't mix well with alcohol at all.
You hit the nail on the head. It really is a balancing act. You've got those potential positives on one side of the scale, but those very real risks sitting on the other. It's a conversation, a very personalized conversation to have with your doctor.
This has honestly been such an eye-opening conversation. Really makes you think. And it leaves me with this final thought, maybe a little bit of a brain teaser for everyone listening. What if it's not the alcohol itself that's behind these potential benefits, but something else entirely that's hanging out in alcoholic beverages, like those antioxidants everyone's always talking about in red wine?
Hmm. Interesting.
It's definitely something to chew on, and hey, maybe a good conversation starter for your next doctor's appointment. Just remember, folks, this is just the start of the journey. More to come. Keep those brains engaged.